So liposuction can be a little bit of a confusing procedure itself for patients to navigate their way through because there are so many different types of liposuction available today. In essence, liposuction is just removing fatty tissue from underneath the skin and allowing the skin to shrink. Most of the different types of liposuction that are available today really are just different ways of getting that fat out. In some instances, surgeons will employ or use ultrasonic energy. Sometimes these come under commercial names of different procedures that produce the particular liposuction cannula that allows us to melt the fat first and then suction it out. Some surgeons will use a laser that helps melt the fat before it is suctioned out, and some surgeons will use power assisted, where the actual liposuction cannula itself either vibrates or rotates and allows the fat to be removed more easily. What's really important to understand is that each of these different methods of liposuction really help the surgeon more than they help the patient. They're different ways of removing fat, and that's it. As to whether or not they actually produce better results, this is highly controversial, and most people will say that it's more important who's on the end of the cannula operating it than what the cannula really is. And so I think it's more important for patients to choose a surgeon who's skilled at liposuction and understands the pitfalls that can be created if an unexperienced surgeon is performing the procedure. This is why it's so important for liposuction to be performed by a board-certified plastic surgeon. It's also important that it be performed in an appropriate facility. Here at Park Meadows Cosmetic Surgery, both my partner, Dr. Chris Williams, and myself are board-certified plastic surgeons with decades of experience now in cosmetic procedures of the face, body, and breast. And we perform all of our procedures at Park Meadows Outpatient Surgery, which is adjacent to our current offices, where we have a full state-licensed, Joint Commission accredited surgical facility, which is credentialed in a manner that hospitals are credentialed in, assuring you the safest operation possible. We think this is critical to making sure that patients are cared for in the safest manner possible. The oath that we all took as physicians when we finished medical school was to do no harm. And we feel strongly here at Park Meadows that that oath shouldn't be checked at the door because we're often talking about cash-based surgeries. The most important commitment we have is to your safety.